I mean, it's a lot. So this is good to overview a little bit. I need you to understand that this is a DVT. Yes, there's different things to do. The test of choice is this. So I would write down DVT. Test of choice is ultrasound, compression ultrasound. You want to see if it's a non-compressible vein versus compressible vein. D dimers are great, but the person had surgery. And look at the other ones. 7%, 8%. That's pretty big, isn't it? CT pulm. Here it is. CT pulmonary angio. Test of choice. Pulmonary embolism. So this wasn't a PE yet. Yes. TTE. This is an awesome answer. TTE would help in diagnosing right heart failure due to a massive PE. See, this is what I mean. So now we did cardio a while ago. Cardio is another thing. Cardio is very important. So I want to ask you guys one thing, ladies and gentlemen. You have right-sided heart failure, left-sided heart failure. How can you know if a person has right-sided heart failure? So I want you to write in the text here in the chat. If it's right heart failure, right CHF, right? What would you see in symptoms? And then if it's left-sided heart failure, what would you see? So if you can write down both, that'd be great, because that's important. It's the symptoms that they provide in the question stem that will allow us to dictate one from the other. You know, right-sided heart failure. Well, look at the heart. Heart's pumping. If the heart slows down and can't pump as much because it's heart failure, the blood backs up. So follow the flow. The blood usually goes inferior vena cava, superior vena cava into the right atrium, right ventricle to the pulmonary vessels, out to the lungs, comes back in the left atrium, left ventricle, out the aorta. Okay. So yeah. So if the heart isn't pumping, the blood is going to back up the superior vena cava and down the inferior vena cava. I say cava, same thing. So if you want to sound more intelligent, the superior vena cava. Yeah, man, same crap. So SVC, right? So if the blood is pumping backwards up the SVC, JVD, you're going to start seeing pulsating. Like Mr. Smith is laying there 45 degrees and you see the JVD pulsating, jugular venous distension. It's like, whoa, it shouldn't be pulsating that much. So that's one symptom, right? What are the other two? Well, the blood is going to go down the inferior vena cava. It's going to go portal hypertension because it goes into the liver, right? A liver enlargement, hepatomegaly, and then also peripheral edema. The blood flow is going backwards, guys. So that's right side heart failure. JVD, portal hypertension, hepatomegaly, and peripheral edema. All right. Left-sided heart failure. Well, the blood can't pump out of the aorta fast enough. So backs up into left ventricle. That backs up into left atrium. And then if there's high pressure in the left atrium, what kind of pressure we're talking about? What's that word in cardio? PCWP, pulmonary capillary wedge pressure, is equivalent to left atrial pressure. Yeah. So left atrial pressure, if that's enlarged, PCWP goes up. That then backs up into the lungs. So isn't it interesting when the patient goes, doctor, well, I can't, when I lay down, after a couple of maybe an hour or so, I start feeling like I'm going to choke. I can't breathe. So they have to lay with a few pillows, right? So the lungs get flooded with blood because the heart is not pumping. So you see, it's important to know these different phrases. Good. Okay. So it says here, yeah, TTE would help diagnose right heart failure. So, and the blood cultures we said earlier, for bacteremia, cellulitis, manifests with fever as well as local swelling. However, it also manifests with erythema, which is not seen in this patient.